Good morning. Good to be with you again this morning. Hope you're having a great day. I'll wait a few minutes here just to get a few people on. Question and answer Friday. Here we go. Sue, you're the first on this morning. Nicole, bon matin. And Mike, Jeanette from our staff. And Andrea from Niagara Falls. Nativity, good morning to you. Nice to... Venierans, how are you? Are you new? Rosa, Susan from Florida. Deb, good morning to you. And Kat, nice to have you on this morning. Okay, we appreciate it. Micheline, dear faithful, you guys are great. Thanks again for coming on. Shelley, nice to have you. Susan saying it's Friday. Yep. Good to have you on. Len and Judy from Edmonton. Linda, St. Jude, Quebec. Madeleine, Temiskaming, Quebec. Okay, Joss, Sturgeon Falls, and Jeanette. Much appreciated, guys. We appreciate you very much. Nick from our staff on this morning. Good morning. Oh, Michelin says you like my blue top. Okay. Zian, comment ça va? Nice to have you on. Okay. And Anne. And Jerry, what about those Habs? Going to Vegas. Okay, should be fun. Maria and Lynn, it's your birthday? Lynn, happy birthday to you. Lorraine, and Lorraine's husband from Welland, and Carol from Newfoundland, Tilsonburg, Fran. Linda from Grand Falls, New Brunswick. Guys, coast to coast, the United States, Canada, around the world. Diane, another Diane. Good to have you on. Denise. Okay, Denise feeling better? Yes, from Alberta. Okay, we were praying for you, Denise. Connie, Sherry. Okay, Yolande. Good morning to you. Nice to have you on this morning. Okay, guys, thanks again for watching. Soon to be podcast. Kim from Timmins. Ingrid, Calgary. Sunny there. Okay, great. Cheryl. Okay, here we go. Nellie, nice to have you on. Okay, so question and answer, and I'll come on and say hi to the rest of you after. Okay, let's just get this going here, and then we should be all right. White bumps on the skin in the sun. Is it fungus related? Maybe. Maybe. Anytime you see anything coming on the skin, remember that, okay? I mean, you can get hives, and that's usually, but if you look at anything that comes on the skin ordinarily, leaky gut, leaky skin. You'll never go wrong treating the gut. Leaky gut, leaky skin. Leaky gut, leaky brain. Leaky gut, leaky joints, okay? So it's one of the trifecta of all disease is the gut. The bacteria, the war, the invisible war, I call it. Okay? So that is really, really important that you, the white bumps could be fungus, and the sun can bring that out. Okay? Don't burn in the sun, but you need the sun. Viderma. Did you get your Viderma? Guys, there's so many studies on the benefits of vitamin D, the sun. It's incredible. Now, don't go burn, okay? So you'll never hear me tell you to burn. in 20 minutes. You get 10,000 international units of vitamin D, but also you get high levels of nitric oxide. And also you're a human solar panel, and every cell in your body. We didn't know this 50 years ago. We didn't know this. That we knew, like guys like me in alternative medicine always pushed vitamin D. And you guys know me, if you've heard me in the last 20, 30 years, I've been screaming from the rooftops. I'm going to show you a list of my books. Now, if you're on the podcast, you can't see it, but I'm pointing to, I think I'm up to 21 books that I've written. And I can't think of a book where I didn't talk about the importance of vitamin D, the sun. So get your Viderma. Don't you like that word? I'm telling everybody. Viderma. Okay. And okay. Joanne's asking a good question here, okay? She says, do you think it is healthy for people never to eat a vegetable or some berries ever again? Well, let me put it this way, Joanne, okay? I never suggest to anyone to do that. And look, it's not that you couldn't live. There's a popular diet out there now called the carnivore diet. And you can live like that. Okay, you can live like that, but you don't hear me preaching that. And I mentioned this yesterday, and I get it. I understand why doctors do this all the time, but this guy he actually thinks outside the box. I mentioned this to you. He said on a healthy plate, you have 75% vegetables and 25% meat. And I said to him, okay, now reverse that. 75% meat and 25% vegetables. And guys, look, for 30 days, there's huge reasons why no vegetables. I don't want no oxalates. I don't want no cellulose. I don't want no lectins. I don't want any gluten. I don't want anything that would even hinder. I don't even allow you to have any berries, no fruit. But there's a reason for that. I want your pancreas, your insulin, your gut to have a complete rest. A complete rest. And so, but, who is going to live like that forever, right? Never to have any vegetables or any fruit, okay? You know what I call fruit? God's candies. Limit your fruit. We live in a different age now. And I always emphasize that because we live in such an unbalanced world. As far as eating, we're carbaholics. And so when you try and fix that, you can go low carb, but better, I'm telling you, much better to do the reset first. It resets the body. It takes you out of metabolic syndrome. It fixes all your blood work of your triglycerides and your HDL and your CRP, your C-reactive protein comes down. Everything gets better. And then you introduce again your vegetables and limited fruit. Limited fruit. Okay? So, good question. Okay? What's Dr. Martin think of acupuncture? I love it. Well, look, I'm no good at it. I took a course, okay, 1972. In those days, you could get fully certified in acupuncture. In 1972, I took the course, but I never really practiced it. I had a doctor work with me who was an acupuncturist in the 80s, I guess. He was very good. He knew his stuff, and I like it. Okay, but you have to be completely certified. And you get Dr. Troy, for example, who teaches acupressure too. I love it. It's good for you. It's not my expertise, but I certainly have no problem with it. What is Dr. Martin's opinion on fulvic acid? Well, I don't have a lot of experience with it. It's not that I'm negative. I look at that almost like activated charcoal. And there was a lot of hype about that stuff at one time. Nah, never really passed for me, the smell test. And I tell people, look, what are you using it for? Okay. And then I say, well, this is better than that. Okay, in my opinion. So, I don't have a lot of experience with it, so I'm not going to comment too much. Does drinking the peg drink, when you get a colonoscopy and they get you to get ready for a colonoscopy, the question is from Carolyn. And sorry, Joanne, you asked the one about fulvic acid, and Kent about acupuncture. I didn't mention your name. Sorry again. Joanne and Suzanne, so far. Does it kill all the good bacteria in the gut? Yeah, when you do a colonoscopy, you're getting rid of your microbiome, a lot of it, and you're not going to get rid of all of it. But I'm a big guy. You take your probiotics up. If you're going to get a colonoscopy, take your probiotics. You should be taking your probiotics. And, the day before, whatever, you get ready for your colonoscopy, you don't have to take any probiotics because you're going to wipe out that flora pretty well. Then you better double up your probiotics for about 3 or 4 weeks after a colonoscopy. You just want to replace that flora because just the procedure, never mind the peg, the procedure is hard on your microbiome. But look, I'm not telling you not to get a colonoscopy. Don't quote me there because I'm not saying that to you, okay? Lois, would you comment on polymyalgia rheumatica? Okay, well, that is where you get an acute onset of just about every joint in your body becomes inflamed. I believe it's viral. It's viral. I've seen it many a time in my office. And I used to have a protocol to really help. And it was very antiviral because I used to believe that was a virus that attacked the body. And I was big on oil of oregano, high doses of vitamin D. I use our inflammation formula, high levels of curcumin, and high levels of probiotic, and therapeutic doses that I used to do. Okay, Lois, Marna. PEA. Oh, yeah, I've seen it. PEA for pain. Again, and Marna, look, I'm not against this stuff, okay? But you have to understand, for me, my experience was putting combinations of things together. So if you look at our inflammation formula, we have 8 different anti-inflammatories in there, and they're chosen for a reason. Look at our cortisol formula. Different formula, different ingredients and the therapeutic doses of those ingredients at the right levels. And again, that just goes to our experience, okay? So when we make a formula, it's based on clinical results, okay? So, there's a lot of good products on the market, but are they therapeutic in their dosages and in their ingredient list? That's us, okay? Because I had to get, in practice, I had to get results. So when I recommended something, I had to get clinical results. I didn't just see that patient once. We would follow up with that patient, and whether I gave them a certain eating program or whatever, I had to get results. So when you ask me about PEA, your body actually makes that. Therapeutically, I don't know. I didn't have a lot of experience with it. I seen it, I've read about it, and I'll put our inflammation formula against it. Curcumin, ashwagandha, vitamin D, boswellia. It's just stuff that I used. And Tony Jr., biochemist, we work well together because he would come up with not only we would talk about the ingredients, but the amount in there to get the therapeutic doses, okay? So Marna, thanks for the question. Laura, asking about skin tags on my neck, will they shrink or fall off, Laura, when they do the reset? They might, because skin tags, guys, are a sign that you have insulin resistance. And a lot of people doing the reset have noticed that their skin tags got a lot better or completely fallen off. And so when you see skin tags, usually, guess what that is? That's insulin. That's your body. The reason I say this, because it's really important you get this. For a lot of people, as a matter of fact, most people today, blood sugar is a lagging indicator. What does that mean? The last thing to happen for a lot of people, not everybody, for a lot of people, is their blood sugar goes wonky. But way before that, the body is screaming at you that you have insulin resistance. It really is diabetes. Diabetes before you become a diabetic. But for the sake of talking about it, doctors don't like that because you're not a diabetic. Your blood sugar isn't above, 6.5. Or your A1C, we talked about that, was at the start of the week or whatever. I can't remember exactly what day. We talked about A1C, which is hemoglobin in your red blood cells, and sugar attaches to hemoglobin. Oxygen attaches to hemoglobin, but so does sugar. And once it attaches there, you can't get rid of it. And that's why we talked about that A1C. But a lot of times, guys, the body will scream, hello, hey, you there, acid reflux. Well, I just got to take more Tums. Acid reflux. I got to, no, it's your body screaming. 95% of the time, it's your body telling you, hello, check the engine light is on. Your body is unbelievable. Somebody's asking about I'll come to it after, but let me answer it now. I'll just acknowledge who asked it because I can't see it right now. Let me see. Maybe I can. What about plantar fasciitis? Where is that? I did see it. Did I miss it? Anyway, Shirley, you asked about plantar fasciitis. 95% of people that deal with plantar fasciitis. Now, I'm not saying there's not a localized foot problem, a posture problem, flat arches, blah, blah, blah. But when you get any itis, it's usually, and I explained that actually in the reset, in the book. I talked about it because you get what we call glycation. Big word. What does that mean, glycation? It means literally like you lose the elasticity in tendons and muscles and things like that. You don't have the elasticity. And we call that glycation. Glycation is caused by sugar. Sugar. And a lot of people, they get a tendonitis, even in their elbows or whatever, and they don't realize, I know I got tennis elbow. Okay? Whether you play tennis or not, gripping or whatever. But when it doesn't heal, it's your body saying, hello, you. You are a carboholic. You're eating way too many carbs or sugars or both. It's the body's way of trying to get your attention, and a lot of people are not listening because they don't even think of food could be causing it. They get acid reflux. Oh, you know what? I got acid reflux. Bursitis, tendonitis, all these things. Glycation. It's one of the ways your body screams at you because of sugar. Sugar is so destructive. But we have this diagnosis today of diabetes, and it bugs me because I could tell people in the office, if, I grab their little face gently and say, look, you're in trouble. Change your diet. It's food. The magic is understanding that. And once you understand that, you and carbs don't get along. You got a bad relationship. You're being abused by carbs and you're going back to that relationship. It's abusive. Why do you expect any different results? Carbs are abusive to most people. What are the studies saying now? CDC, I've talked about this a billion times. 88% of the population, 88% or more, have a bad relationship with food. But I'm not a diabetic. Yeah, but you got bad triglycerides, you got fatty liver, you got low HDL, you got visceral fat around your organs. You got all the signs of metabolic syndrome, and metabolic syndrome affects cancer, cardiovascular disease, Alzheimer's, autoimmune. Guys, it's complicated, but it really isn't. I don't know how many years ago, 20? It was like a light came on, click, in my head. Tony Jr. and I talking, said, man, the world is changing. I've never seen so much insulin resistance. Insulin. It's not like it wasn't around before, but now it's crazy. And so I don't want to be that simplistic, but it really is food. And we live in a world where that just doesn't get it. A world that is focused in now on a virus. I posted this last night on the private Facebook group. Anybody, almost no exceptions. I didn't say it. The world has said it. Scroll down and see, or maybe I'll post it again. You didn't go to the hospital with a virus. You were not hospitalized. Remember the elephant in the room? You were not hospitalized unless you had two things. One, insulin resistance, metabolic syndrome, 100%. Two, low levels of vitamin D. It was universal, guys. It was universal. But instead of, all the emphasis was on treating the virus. And I guess when you get really sick, what choice do you have? But to the rest of the world, they didn't get the memo. What affects your immune system more than anything is food and the sun. Sun, steak, and steel. No, but seriously, guys. And you know what? It what makes steam come out of my ears. I look at people and they're walking around, they got a mask on, and they're eating Twinkies. They pull their mask down to have their Twinkies. Or they want you to get a vaccine, and they lure you with in the United States with donuts. Guys, that's why I get so excited in a negative way, because I think it's like we got a mask, never mind here, over our eyes, and we refuse to see the truth. They refuse to see the truth. Metabolic syndrome not only makes you more susceptible to cancer, to cardiovascular disease, Alzheimer's, diabetes, obviously, but it affects your immune system to fight viruses and bacteria. Your immune system suppressed. And then you get a perfect storm, because bigger people, like obesity and whatever, they don't even realize this. When you take a person that's got metabolic syndrome, 99% of the time, they also have low levels of vitamin D. They're dehydroxy, vitamin D, 25. in their blood is very low. It's consistent. It's almost 100%. And nobody talks about it. Nobody talks about it. It really would be, think about it. It would be the cure. We're always going to have viruses, guys. Coming to a theater near you, always. In the fall, are we going to lock down again? Probably. But nobody wants to talk about the elephant in the room. Nobody wants to talk about, hey, why don't we take care of our immune system? How about we cut out, at least preach it. People are going to make their own minds up, but at least give them the information. But what do you have? You have medicine that knows squat about nutrition. Gee, you go to the hospital. What do they feed you in there? It's crazy. Who makes those decisions? I can't stand it. Okay, better get going. I'm getting too excited. Okay, so Shirley, I answered Mary. There's two Marys, okay? So Mary 1, what does Dr. Martin think of caffeine pills for those who work the night shift? I don't like it. Drink coffee, because then you get vitamin C. Caffeine pills, be careful with that stuff, okay? Like even, kids drinking these caffeine loaded or whatever, to keep yourself awake and drink. I hate that stuff. You're playing with fire there. Russian roulette. I wouldn't do it. No, I mean, you know me, I'm about coffee. Drink coffee. Okay? And people ask me about decaf. Decaf's good. It's the bean for vitamin C. Okay? Try and get the water, Swiss water decaf, because there's no chemicals used to decaf the coffee. Okay? But I don't like it. I don't like energy drinks, and I hate that stuff. Okay? And I don't like caffeine pills. I don't. The other Mary, if I eat fish 2 or 3 times a week, why do I take omega-3 capsules? Well, I wouldn't take omega-3 capsules if you eat fish 2 or times. The only thing that I would recommend, Mary, and you got to figure this out for yourself, but if you're asking me, if you eat fish, see, I have fish every day. I had my fish this morning in a capsule. Every day. But therapeutically, Mary, good question. Therapeutically, I am big. I am convinced. I've seen it. I am big on not omega-3 per se. I am very, very convinced on high DHA. Because your brain is made up of DHA. And all I'm saying, Mary, is this. Okay, and by the way, you eat fish 2 or 3 times a week. If you eat grass-fed beef, you're going to get more DHA, more omega-3 in there than you will in fish. Is fish good? 100%. But vitamin S, steak, is better for omega-3. So whatever you, and guys, I eat a lot of vitamin S, okay? I eat a lot of vitamin S. But I therapeutically, okay, understand, and this is, okay, if you're asking, here's the answer. If you're going to take omega-3, then you make sure there's a lot of DHA in it. There's EPA, DHA. EPA is good. DHA is better. Simple as that. And therapeutically, for people who have cognitive issues, who want to protect their brain from Alzheimer's. I mean, it's the diet, it's lowering your sugars and all this and that, but DHA is therapeutic in the right dosage. And I'm big on that. I have proven it to tens of thousands of patients. Concussions, ADD, ADHD, cognitive issues. If you can get a dementia early enough, I would put DHA up against anything. Probiotics too, but for the brain, therapeutically. You see, for me, Mary, I want to prevent, I need my brain. And DHA for your heart. It's oil, it's lubrication for your heart. And there's nothing better. It's so anti-inflammatory. But that's why, Mary, I like it therapeutically. But listen, if you don't want to take supplements, and I agree with you, by the way, don't just take omega-3 for the sake of taking omega-3. If you're eating fish, don't do it. But therapeutically, I would recommend you take a high DHA. And I recommend that to anyone. If you're going to do something, do it right. Okay? Do it right. And, it's a real good question, Mary, because look, you know me, I'm a food guy. There's no one that preaches food more than me. Food first. You can't out-supplement a bad diet. You can't out-exercise a bad diet. You can't. You can't do it. Your diet needs to be good. But if you have that, that is the foundation. And again, somebody said, what? I have to take a lot of supplements in the morning. Well, you know what? You should see what I take every day. I see it, look. And again, this is up to you, but I see it, if you're asking me, I see it as, for me, I look at my body, I put it, a lot of people make investments, and good for you, I had 2 restaurants. Don't get into I was going to write a book. I never finished it. Don't get into the restaurant business. Why not to get into the restaurant? Anyway, because doctors, we make investments. We make money. We make investments. I invested in real estate. I invested in this. I invested in that. Some were good. Some were not so good. Okay? But the best investment you're going to make is into your body. People, you know what? I'm going to live my life and I'm just going to eat whatever I feel like and blah, 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 and let the chips fall where they may. And you know what? Okay, that's all right. If that's what you decide, hey, I don't have a gun pointed at anybody's head to take supplements. But if you ask me, I say, if you're not taking a probiotic, you're making a mistake. That's me. If you don't get enough sun and you don't take vitamin D, you're making a mistake. Sorry. Okay? You don't, you don't take DHA and you want your brain to last, in my opinion, you're making a mistake. I mean, there's some foundational things that I am very big on. And sometimes I put people on with therapeutic things, hormonal, dim, lots of stuff. But again, there's my philosophy. And I'm pretty consistent about it. Okay? The only thing I've ever changed my mind on, no, I shouldn't say the only thing, is probiotics, because I went from taking them a couple of times a year 20 years ago to, I believe, should be daily. The more we study the microbiome, the more, we need it. Everything, this week we talked about the chemicals and all the xenoestrogens and plastic. It's in the air, it's here, there, everywhere. Everything, these things get into your body, they destroy your microbiome, they are, but how do you get away from that? What do you plan on doing? Going to live on Mars? You're going with Elon Musk and taking one of his spaceships and you're leaving the planet? Well, good for you. I'm not joining you, okay? So I got to live on planet Earth. Yeah, well, there's some issues with planet Earth. And, to me, it's not the climate. Okay? It's the chemicals. It's our food. It's in everything, guys. Anyway, okay. I'm over time here. A couple of more. Rosalinda, is there blood pressure valve, release valve in the kidneys? Yes, there is. There's, usually between your ureter, there's little valves there, and those things can stop working. Will it affect your blood pressure? It could. It could if you don't, if they get backed up. And again, kidneys, you know what affects the kidneys? Two things, Rosalinda. Two things are going to affect your kidneys. One is insulin, sugars. It's not salt, it's sugar. And second is H2O, water. Excuse me, vitamin W. Vitamin W. You need water. Kidneys are Niagara Falls. Joy, irregular platelets. I get black and blue suddenly. What could cause that? Well, you better get that checked out. You want to make sure that you don't have some kind of blood disorder. That can come suddenly. Make sure, Joy, and if they're saying it's sort of benign and no big deal, then that's good. And don't eat too much salad. Get K2 instead of K1. Okay? And I like our blood boost for that. Okay? Oh, Sherry's asking about tilia tomentosa. Yeah. Again, I'll just say this, Sherry, that I'm big on, look at our cortisol formula. Everything in there is what I know works. Other things, there's other things I could have put in there. But I didn't have the experience with those other things combined. I'm a combination guy. And so, you want to try it, tilia? I got no problem with that. But again, you put it up against our cortisol formula, I'd say there's nothing like it. John's saying, stay away from carbs. Yep. Because they cancer-causing acrylamide. Well, acrylamide, potato chips, peanuts, in mostly found in carbs. And yeah, you stay away from that at least temporarily. And potato chips, do I got to tell you? Women like potato chips more than men do. Cecile, sorry. Lack of, loss of taste. Can it be a lack of zinc? Yep, it could be. That's usually the first thing that I think of when you lose your taste. Or COVID. COVID, that's one of the classic things. But with COVID, what did they find? It used to be therapeutic to give zinc. And they got away from that. They got away from that. Okay, I think, and last one. I think I got them all. What causes edema? Well, a lot of things, Rita, cause edema. Okay, it could be kidneys. It can be dehydration. It can be congestive heart failure. You need to check it out because there's a lot of things that do it. Okay, and it's usually in those top three things that I check for. Okay. You guys are great. Thank you very much. Okay. Thanks for your patience. We appreciate it. Thank you for joining the Martin Clinic Facebook group, that private group. What a great group. I love reading all the posts and all the stuff and the back and forth, and keep it civil. Okay. Keep it civil. We don't want to. Well, Tony Jr. sort of says this all the time. We don't want to lose that platform, okay? Because first of all, we're in the alternative health, and Facebook doesn't like that. They like our group because they love interaction, but we got to keep it civil and we got to respect each other, okay? That's really important. And, you got a different opinion. I might come back at you, okay? But that's all right, okay? You know what? I heard something the other day. Okay, I really liked it. You need to develop a thick hide and a tender heart. A thick hide and a tender heart. I like that. I want to keep my heart tender towards people. I love people. Okay, and I love you guys. We appreciate you very much. Talk to you soon.